I'm Sam Roberts of the New York Times, and welcome to the New York Times Close-Up. This week marked the official end of the COVID public health emergency. We'll discuss what this means for New York City. But first, what has been the pandemic's impact on commercial real estate, small businesses? We know it's flattened the market in Manhattan. Now, small businesses outside Manhattan are facing the biggest rent increases in the city. Owners are worried that sharp rent increases and a lack of protections could shut down their stores. In the Rockaways, monthly rents rose almost 38%. Several neighborhoods in the Bronx, rents rose 33%. Stefanos Chen, real estate reporter for the New York Times, joins us to talk about what the impact is in other areas of the city. Stefanos, why are rents rising in those areas, and do owners of those stores have any protections?
I think what we're looking at is the after effects of the pandemic. We're just kind of now grappling with what it's meant to the economy in the city, and how the office market in New York has been the economic engine for so many decades. And with that market really cratering during the last 3 years, the ecosystem that was supported by it, all the stores in Midtown Manhattan, are still suffering. So what we've seen instead is a shift towards these other boroughs, Queens, Brooklyn, in the Bronx, a bit in Staten Island, where we've had both a surge in new business creation, in part because people lost their jobs and they tried something new, and the fact that landlords now, seeing that Manhattan rents are down, expect now that they can raise the rents in these outer boroughs.
How does that work? Are people not going to work in Manhattan, and that's why you see so many storefronts saying for lease, and they're staying home and doing retail business, shopping, restaurants, whatever, in the other boroughs?
I think it's a question of demographics. And when we talked about the quote-unquote exodus of folks from the city early on in the pandemic, it was primarily more affluent people who lived in Manhattan, who worked in Manhattan. But the folks who lived in the other boroughs, in Queens and Brooklyn, these were not folks who left the city primarily. These are what we were calling the essential workers. These are people in retail and hospitality who didn't have another home to leave to. And so the commercial sectors of those areas, those districts, weren't hurt as badly because people had to live there.
And are rents still falling in Manhattan, or they've flattened out?
There are several areas where the rents are still down. In Lower Manhattan, they were still down by double digits for storefront rents. But it's either down or flat in most parts of central Manhattan, whereas the outer boroughs have gone up quite substantially.
And you've written in the Times that the steep rent increases in the other boroughs affect people in two categories. One, a lot of minority people, Black, Latino people, and also people who are entrepreneurial and starting new businesses.
Yeah, but the data shows the trend that is pretty disturbing for the city overall, which is that these areas, nearly 3/4 of the population where rents on these storefronts rose were people of color or immigrants, or both in many cases. So these are the folks who, when you think of small business, these are bodegas, these are shoe shine stores, these are small restaurants. And they are also sort of a touchstone for a lot of the culture in these ethnic enclaves. So when these stores get hurt, a lot of the services you can't find elsewhere in the city are also disappearing.
So with the pandemic emergency officially over, did they qualify for any sort of pandemic aid, or did they?
A lot of that money has dried up, and reviewing the numbers there, a lot of these same businesses did not qualify, often because, as we see from federal programs from the SBA, they did not have accurate paperwork. A lot of these companies didn't keep great records. These are cash businesses in some cases. There may be immigration status issues with some of these businesses where they don't qualify. And in other cases, they're just too small. They're too small even for these requirements that define small business. I mean, we're talking in some cases it's one person, one employee, or two people. And they didn't hit the revenue requirements.
We mentioned before some double-digit rent increases in some of the other boroughs. What is the normal rent increase that would have been pre-pandemic?
Well, brokers we spoke to said in pre-pandemic era, between 3% and maybe up to 5% would be.
And that's a year?
Annually, yes, per square foot on these rents. But in the cases we've seen here, either in these outer boroughs, the rents have exceeded that significantly, or things have continued status quo, which is just as bad for some of these folks because they are facing also very large rent arrears. There are several months that they weren't able to pay because their businesses were shut down by pandemic requirements.
And is there any help for them from the city, from the federal government, from anywhere else?
The city has several programs in which they try to help small businesses, but the scale of them is pretty small relative to how many businesses we're talking about. There is help in terms of commercial lease agreements, negotiations for some of these businesses, but there's a matter of understanding what these are for some of these businesses. They might not have the language skills or the business savvy to get access to them. And in other cases, find themselves defending themselves in court, which in many cases they can't afford to hire a lawyer. So,
residential tenants in the city have lots of rights, maybe not as many rights as they'd like to. But what about commercial tenants? Do they have any rights to renew their leases? Do they have any controls at all on the amount of rent increases?
They do not, and I think that's surprising to some folks. There are rent-regulated tenants. If you have an apartment, you have a right to a lease renewal. You have a right from very large rent increases on an annual basis. Commercial storefronts don't have any of that. And there is some legislation being proposed, even pre-pandemic, to help stabilize rent increases for storefronts. But as of now, it's still sort of pending.
Is that likely at all? I know commercial rent control has been proposed many times over the past decades. Is there any kind of political sentiment for that?
I think that there are quite a few sponsors on the bill that is currently in the works in the City Council, though when it actually gets decided upon could be a while, and there are quite strong interest against it in the real estate industry that do not want rent control for storefronts.
Stefanos, Ed Glazer and Carlo Ratti had an opinion piece in the Times the other day saying that the amount of vacant office space in the city would fill 26 Empire State Buildings. That is a lot. And what they said is that probably is not going to change. And they suggested that the city has to change from a place to live and play rather than work. Is that going to happen? They called it a playground city that's going to have to be created. That's a big change in what the city is envisioned to be.
And I think the other boroughs outside of Manhattan already sort of reflect that, because when you think of Lower Manhattan, which is one of the worst hit in terms of rents for the office market, it's because people worked 9 to 5 there and they left. Mm-hmm. And we saw in past decades when the city was in financial straits that Lower Manhattan, a lot of the offices that were not filling up were converted to residential. And we may be in a moment now where a lot of these empty office buildings could again be converted to affordable housing or some other mixed-use purpose that currently doesn't exist.
If they convert office buildings to residential housing, what are the people who live in them going to do for jobs?
It's a good question. Mm-hmm. I think that's showing already the dichotomy between how these outer boroughs are the rents are rising there and they're not so much in central Manhattan. So we'll have to figure out in the years to come whether there is a balance that Manhattan can strike, because it's still so long been the economic core of the city.
And is there a real movement to actually begin that conversion, or are developers, landlords taking a wait-and-see attitude?
Well, I wrote a bit about the same approach with hotels. Many of these hotels were emptied out and they were supposed to convert, and just very recently the first one began its conversion process after years of political grandstanding. So I'm not super hopeful that the city can do these at scale with commercial buildings, given also high inflation, the interest rates on these buildings. But there seems to be political will to get it done. So
and also the physical configuration, as you've pointed out.
Yeah, the depth of some of these floor plates just makes it very not conducive to living. But there are quite a few that could be changed, and we'll see if that actually comes to pass.
Also, you've written about migrants in the city, the flood of migrants coming in, the influx, the new flood that is expected because of lapse in federal regulations at the border. Suburbs have resisted Mayor Adams sending migrants to their counties. Do they have a right to resist that?
I think the elected officials there have been very resistant. Ed Day in Rockland County, for instance, has been very vocal about him not wanting to take any of these asylum seekers that Mayor Adams had proposed sending there. As of right now, I think the courts will decide. They have been very proactive in trying to prevent these actions. They declared a state of emergency, so we'll see if that holds. But as of right now, New York City certainly is facing a wave of asylum seekers, and the areas outside of New York City, the city would say, are not doing their fair share.
Theoretically, could New York City declare a state of emergency and say, we're not going to take any more asylum seekers either?
In fact, New York City did declare a state of emergency because of their migrant issue, but sort of the opposite. They did so that they can cope with the waves coming, whereas in the other counties we're discussing, it's being used to sort of police and prevent folks from coming in.
And as the Times reported, the mayor has weakened some of those regulations that guarantee housing to migrants. What does that entail?
It's to be decided. These are very important protections we have, the right to shelter in New York City, which makes us different from many other major cities in the country. So to weaken those protections is not a great sign for the future of asylum seekers in New York. But Mayor Adams' view is that it's necessary now because they're anticipating thousands more migrants arriving in New York City.
Let me switch to a totally different topic. You cover casinos for the New York Times. Tell us the latest. What's going on?
We had a fun one the other day on Midtown East, right next to the UN. If you've ever walked by First Avenue, there's this 3-block wide strip. It has been vacant since 2000. It used to be a Con Ed station. And the developer of that site has been thwarted time and again to do what he wanted there. It now is bidding to put a casino and a mixed development.
Is that where the Ferris wheel is supposed to go?
So the Ferris wheel is now, they've put the kibosh on that. The community board has already said, we're not going to stand for that. Instead, I think to sort of warm up the local community to what they plan to do, they have proposed gifting the city, in their words, this 17,000 light art installation by this artist Bruce Monroe, who's done this elsewhere, and it's a very interesting installation. And they're going to stake these fiber optic flowers into the ground there, 6.7 acres of a site, and it's going to be up beginning in late September for a full year.
Why would the community be won over by something like that?
It doesn't seem like they are, to be honest. I've already spoken with the community board there, who have said that this is potentially a ploy to get the community on their side, and what they really want to see is appropriate development for that area.
And what's the timetable now on choosing sites for the casinos?
I think we're at least months away. When I speak with the Gaming Commission in the state, they're still in the Q&A process. They have hundreds of questions to answer from these developers, and it's the first of 2 phases. So we're at least several months away from.
And of course, once they make their choice, it's going to wind up in the courts, no doubt, anyway.
There'll be many obstacles along the way, yes.
Thanks to New York Times reporter Stefanos Chen. And coming up next, officially, COVID is no longer a public health emergency. We'll talk about what that means in practical terms for New Yorkers. After 3 years, the COVID health emergency has ended officially, which means that COVID-19 will be treated like any other transmissible disease. What exactly does that mean for New Yorkers? Joining us from the New York Times newsroom is New York Times Metro reporter Sharon Otterman. Sharon, during the 3 years of the pandemic, you have been pretty risk averse. So what are you doing now that's different from what you were doing before the pandemic was officially over?
Thanks so much for having me on, Sam. I still wear a surgical mask on the subway. That's partially just to cut the regular coughing and sneezing. I no longer wear one at my kids' school. My kids aren't wearing masks anymore. But today, for me, today is just another day. I've been paying attention to how much virus is around, how much virus is in my circles, in terms of people that I know, and that's how I've been judging, whether to wear a mask or not.
What will no longer be available to New Yorkers in terms of health options, vaccines, testing, what else?
Vaccines are still very available, and even after the health emergency, they will be paid for by the federal government until current supplies run out. Once they go to the commercial market, the price, if you had to pay for it, would be expensive, but most of us will have it covered by insurance, Medicare or Medicaid, and there is supposed to be provisions for people without insurance to also be vaccinated for free. Testing is something that is going to be a little harder depending on your insurance. You might have to pay out of pocket for tests now if you get home tests. But the city still has a pretty big supply of tests that the federal government has paid for that they're going to continue to give out at libraries and other institutions.
And where can people go for testing? All those little tents seem to have closed up.
There's still quite a few tents around, especially Times Square. Those are not run by the city. Those are usually for-profit companies that will charge your insurance, or you'll pay cash for those. The city does actually run 4 PCR express sites, which are actually very convenient if you need a fast PCR to travel. And you can find those on the city website. But for the most part, home test, we've been doing home testing anyway. And, the city sort of says that we've been transitioning towards home testing and less testing at this point anyway. So those days when, people were lining up to get tested, will not return.
Sharon, are older people and people with compromised immune systems still more vulnerable to getting COVID, or has that kind of passed?
No, it hasn't passed. We still have about 1,000 deaths per week in the United States from COVID. COVID's still the 7th leading cause of death in the United States. So COVID remains a threat. For people who are immunocompromised, elderly, obviously, the less restrictions put on the general public, the more dangerous it is for them when there's virus circulating. And so, we're really hoping that there's not a lot of virus circulating. If it turns out that one of the variants that's either exists now or that will exist in the future comes back and there's a lot of virus circulating, either we will have to restore some of these protections, or people who are immunocompromised or elderly will really have to be careful.
You've written that an awful lot of New Yorkers have lost at least one relative to COVID over the past few years. What do those numbers actually look like?
In 2021, the Census Bureau, in combination with the city, went out and did 7,000 or more than 7,000 interviews with families across the city. They were a representative sample. And they, extrapolating from that, figured out that around 2 million New Yorkers, which is about 1 in 4 New Yorkers, have lost at least one person they were close to. And that could be a relative, friend, or anyone they identified that they were close to the virus. And then even more surprising, perhaps, is that 900,000 people lost 3 or more relatives or loved ones to the virus. So that's a city dealing with a lot of grief and a lot of loss over these last 3 years.
How do those people feel knowing now that the pandemic is officially over? Do they sort of feel at a loss in a way?
The pandemic is not officially over. The pandemic continues. The emergency is over. The WHO, also ended its international global emergency, but said that the pandemic is still ongoing. I think all of the people who lost loved ones are always concerned, that somehow, they'll be left behind, or their grief and loss will be left behind. On the other hand, there is also a desire to, get back as much as possible to normal among everybody. And so if this is just another marker along the way of trying to kind of get back to something that will never be the same as it was in 2019, but, is approaching normal.
Is there any concern that COVID may return in some other form of mutation? We've seen it mutate in various forms over the past 3 years. Is it gone for now?
No, COVID is definitely not gone. There's like 3 cases at my kid's school as we speak. It is here. It is just at a lower level. And yes, it will ebb and flow. And there's nobody who thinks that it's gone. It will be with us as probably as for the, for decades to come. And I think for us, it's about transitioning to the state where it's an endemic disease that we learn how to live with. And if there is a more dangerous variant that comes up, well, we will have to take steps to try to protect ourselves, more than we are in this sort of peacetime standing that we're at, that
And
we're
if,
transitioning to.
if people think they have symptoms of COVID, even now, what should they do?
People who have symptoms of COVID should test themselves with a home test or go into a doctor's office, urgent care, or one of the city's express tests and get tested. It's still important to know whether you have COVID or a cold. If you do have COVID, the isolation still is in effect. You're supposed to isolate for 5 days and wear a well-fitting mask for the 5 days after that. Even the CDC or the city has not lifted the isolation guidance. And again, as we said before, it continues to be a very dangerous disease for people who are elderly and immunocompromised. And even for everybody, vaccines can help you not get long COVID, but there's no guarantee you can get long COVID, even if you're vaccinated. And so nobody wants to get COVID, both because it's inconvenient, because you have to isolate, and because it represents an ongoing threat to your health if you get it.
And is the city still tracking cases of COVID?
Yes, the city still tracks the cases, but not the home test cases. So if you had a test, let's say upon hospital admission, you usually get tested for COVID. So the city tests the cases that come in to the city and tracks those. And those are available on the website. But we know that that is just a sliver of the total burden, because most people these days just do a home test, if anything.
Quickly on another subject, you've written about fentanyl test strips, helping to prevent drug overdoses. How do they work?
Fentanyl test strip is a little sliver of paper that looks a lot like a pregnancy test. You basically dip it in a little bit of water mixed with the drug. And if it is positive for fentanyl, it shows up with, I think it's 2 lines, no, 1 line if it's positive and 2 lines if it's negative. It's reversed from pregnancy test. That helps people determine whether or not there's fentanyl in their drugs.
Is this for people who are taking drugs? I mean, physically, how do you use it?
It's important for people who use drugs that they're not getting through the pharmacy to test them. And this is true for people who are taking, let's say, illegal pills, like that are supposed to be Xanax, for example, or if they're if they have cocaine. Because fentanyl has found its way into the entire drug supply at this point. So the way you test it, you would dilute, let's say you're taking your cocaine out of your bag, you could put a little water in the bag and then put the test strip in, and then within 5 minutes or so, tell you if it tests positive for fentanyl.
Good to know. Thank you, Sharon Otterman, of the New
News
York
you can
Times,
use.
coming from the New York Times newsroom. And coming up next, my thoughts on, well, a penny for your thoughts. The next time someone offers you a penny for your thoughts, say, forget about it. If you think your thoughts are worth that little, think again. A penny isn't even worth 1 cent anymore. Its value has already declined 20% from 5 years ago. Moreover, each penny cost the U.S. Treasury 2.72 cents to produce. According to the Financial Times, the government spent $100 million last year producing pennies. In this digital antiseptic age, when was the last time you paid for something with a penny? Or didn't tell a salesperson to keep the change? Pennies won't work in parking meters, toll booths, or vending machines. And who plays hit the penny anymore? In 2021, the government produced 8 billion pennies. Only about 1/3 wound up being circulated. That means the rest went from the mint to the Federal Reserve to commercial banks to customers to oblivion. 3 decades ago, a playwright, Teddy Gross, had a great idea. Get school kids to collect all the pennies hidden away in coffee cans, car cup holders, drawers, jars, piggy banks. His penny harvest raised more than 1 billion pennies for charity. Why not have everyone do a penny search again instead of fretting over the debt limit? or discontinue minting those copper-plated zinc coins altogether. Republicans may no longer venerate Lincoln like they once did. He's still on a $5 bill anyway. But Congress has no currency for change, even if it means cutting the budget by discontinuing pennies. The last time lawmakers scrapped a denomination of coinage was in 1857, before Lincoln was president. Congress eliminated the half-cent coin, which was the equivalent today of about 15 cents, or 3 nickels. For the New York Times and CUNY TV, I'm Sam Roberts.